Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Hey everyone, welcome to this video where we're going to talk about UNIVAL, also known as Sucralfate. We'll discover how and when to use it and why it might be a good option for you. UNIVAL is a medicine that is mainly used to treat and prevent ulcers in the stomach and intestines. How does it do that? Well, Sucralfate covers the ulcer with a protective layer, like putting a bandage on it, allowing the tissue to heal on its own. It is especially helpful for peptic ulcers and ulcers caused by stress. So, how exactly does it work? Sucralfate sticks to the proteins at the base of ulcers and creates a physical barrier. This prevents stomach acids and other things that digest food from further damaging the tissue, giving your body time to heal naturally. About the dosage, it is very important that you follow your doctor's instruction. Normally, you start by taking 1 gram 4 times a day, before each meal and before going to bed. Once the ulcer has healed, your doctor may recommend a lower dose to prevent ulcers from coming back. Now let's talk about the possible side effects. The most common ones are constipation, a little dizziness, and dry mouth. Although not as common, more serious allergic reactions can also occur. If you notice any side effects, let your doctor know. Finally, always remember to take UNIVAL as directed by your doctor and do not stop treatment suddenly. Maintain good communication with your doctor and follow their advice so you can fully recover. That's all for today. If you have any questions, feel free to leave them in the comments. See you next time and take care.
If you've made it this far, let us know in the comments why you're using this medicine.